Welcome everyone. I'm Charles Cope. I'm a specialist plastic surgeon. I'd like to thank Trish for inviting me on the Plastic Surgery Hub tonight. We're going to be discussing abdominoplasty, tummy tuck and breast reduction, which are two common plastic surgery operations. So just while we're waiting for everyone to pop on, just tell you a little bit about myself. I'm a specialist plastic surgeon. As I said, I practice on the north side of Sydney. My main room's in Mossman. I've been a specialist plastic surgeon for 20 years now, and I've performed over 18,000 operations, and two-thirds of my practice is performing cosmetic surgery. And this is continuing to increase in Sydney and around Australia. So as a plastic surgeon on the North Shore, I operate every week at the Sydney Adventist Hospital in Prolong, on the north part of Sydney, and also at Castle Crag Private Hospital, which is more centrally located. So in terms of, just before I start, I'd like to just welcome everyone who's coming on, and also ask that if you have any questions, feel free to post them online. There's been a number of questions that have already been posted that I'm going to go through in a little while. So I'd just like to quick summary first of all in terms of the operation. So breast reduction first of all. So breast reduction is a very common operation. I do one or more a week. Breast reduction are a large number of or wide range of age groups. People have breast reductions anywhere from 14 to even 80. So the three main times that people have breast reductions: one, teenagers who develop very large breasts who are G or H cup, finding it difficult to exercise and be active. Then there's another group who wait till they're finished breastfeeding and having children. And then there's a third group of people who, after menopause, a lot of people's breasts get bigger, and then they come and have a breast reduction at that stage. So in terms of operations, this is one of the most common and most popular plastic surgery operations. It's one that's universally liked, and so even though it's a medium-sized operation, nearly everyone finds that this is a worthwhile procedure. So the main reasons that people have a breast reduction is because they have large breasts, they have pain and discomfort, upper neck, back pain. They don't like the fact that their bra digs into their shoulders, and people often have rashes with the breasts, find it difficult to exercise. So if you have this surgery, then you end up with lighter breasts, and most people who have a breast reduction have a lift as well. They have smaller, lighter, more manageable breasts. They're easy to exercise and be active, and it's also easy to get clothes to fit. And as I said, this is a universally liked operation. So in terms of the procedure, it's a medium-sized operation. It takes about 2.5 hours. Most people, with that length of anaesthetic, need to so I just got a message that the sound is very low. I'll try and speak up. Is that better now? So in terms of the operation, as I said, it's a 2.5 hour operation. Most people with that length of general anaesthetic need to stay in hospital overnight and go home the next day. So you need to rest and take things very quietly for the first 7 to 10 days. Most people by 10 days are back to driving, getting around desk works.
You'll still be a little bit restricted, but at that stage, most people can get back to office work. If you have a more active work, and certainly in terms of exercise, it's 3 or 4 weeks before you're back to being able to properly exercise. So in terms of just briefly going through tummy tuck, that's a much bigger operation, or first of all I should say that there are 2 variants of tummy tuck. So there's a mini tummy tuck, which is where you just remove some loose skin without tightening the muscle, and then there's a full tummy tuck where you tighten the muscle layer underneath the skin. So these 2 operations are quite different. The mini tummy tuck the recovery is very much like a breast reduction. Most people can go back to work in 10 days, certainly by 14 days, but a full tummy tuck is a much bigger operation. Most people are in hospital 2 or 3 days after a tummy tuck, and then it's 2 to 3 weeks to just be driving and getting around, but even at that stage you're still quite restricted, and it's more like 6 weeks to really feel normal, be able to be very active, be back at starting to get back at sport, and certainly if you're active at work, you should allow a month to 6 weeks off. So look, I've got a few questions. Or first of all, I should just say before I start going through the questions, in terms of the benefits of a tummy tuck, so as well as the cosmetic benefit of the tummy tuck, there are a number of studies showing that the full tummy tucks where you tighten the muscle layer, you actually increase your core strength and ability to exercise. And a lot of people with after pregnancy and childbirth have problems with pelvic floor, laxity and stress incontinence. These symptoms are improved, and a lot of people who have back pain after a muscle tightening tummy tuck, their back pain is improved just because of the greater abdominal wall strength. So look, I have a few questions, and we'll just go through these questions to start off with, and then, as I said, if other people, I can see there's about 15 or 16 people on so far. If you have any questions, feel free to interrupt and ask some more questions as we go. So I'll just read the first question. So it says, my boobs are still huge but sagging after breastfeeding 2 kids, and I'm thinking about having a breast reduction, but I don't want to end up feeling like I'm too small. How do I know that I'll get a good shape? I really don't want implants. All right. So in terms of things, if you have very large breasts, and we're talking about F, G, H cup breasts, then there is a physical limit on how small you can go. So if you're starting at that sort of cup size before the operation, most people will not get down less than a D cup. So at a D cup, you still end up with a nice breast shape and a reasonable sized breast. And so that's, if you're starting at a F, G, H cup going down to a D, then that's about a third of your the size before the operation. So it will make a significant difference in terms of symptoms of back pain, neck pain, ability to exercise, those sorts of things. But you still end up with a nice, reasonable sized breast and a nice breast shape. In terms of, if you're starting off smaller, so this is an operation that some people have even when they're a D or a double D cup. Now, if you're starting from that size breast, then you can go down to a B or a C cup. And certainly there are some people who come in and say, look, I want to be as small as I can possibly go, but that's not something that I would normally recommend unless people are very insistent on it. There are a couple of reasons for that. First of all, there are some people, if you go absolutely as small as you can, who get a little bit of a shock. If you've had big breasts most of your life, it's part of you. And while having a reasonable reduction in terms of taking half the breast, volume off will improve your symptoms. If you try and go too small, then some people get a little bit of a shock. And also, if you try and go too small, you can actually end up with shape problems. So most breast reductions that I perform, I advise people at a minimum to stay a C cup, although occasionally I will go down to a B cup. And certainly somebody's mentioned implants. There's in fashion at the moment, people are having a breast lift with implants, but that actually increases the size of your breast. And even if you do a small reduction at the same time of taking implants, if you're trying to improve symptoms and get rid of back, neck pain, ability to exercise, then you really shouldn't be thinking about having implants at the same time. Now the next question is about Medicare. So breast reduction, if you've got symptoms like debilitating back and shoulder pain that I've been talking about, which is a very common symptom, still has a Medicare item number. So there are people who have more of a breast lift rather than actually reducing the size of the breast, where there isn't a Medicare item number. But if you're having it for symptoms, medical symptoms like shoulder or neck pain, then there is a Medicare item number. And in that case, if you're privately insured, your fund will pay for all of the hospital, or depending upon the level of your cover. But if you have a level of cover that covers plastic surgery operations, then it will cover all of the bed and the theatre fee, and then part of the anaesthetist fee and part of the surgical fee. So usually for people who are having it for medical symptoms who are privately insured, private insurance will pay about half of the surgical cost. And again, that depends upon your level of cover, but the surgery usually ends up being something like $6,000 or $7,000. But if you don't have insurance, then the operation is more like $12,000 or $13,000. So the fund normally pays about half of it. Now this is an operation, somebody's asked me if you can have this done purely under Medicare. Unfortunately, the New South Wales Department of Health in 2006 changed the rules, and I used to do a lot of these operations in the Prince Alfred, one of the public hospitals. But now, unfortunately, nearly every public hospital in New South Wales will not accept a booking for a breast reduction. So basically, if you want to have the surgery, then you need to have it, unfortunately, in the private system. But as I said, it's a relatively short operation, and most people can go home the next day. So the bed and the theatre fees are not too much for this operation. Right, so look, I think I'll go on to, so there are far more questions on tummy tucks than breast reductions, which was a bit surprising for me because breast reduction is actually a more common operation. So the first question relating to tummy tucks is again on Medicare and costs, and whether health funds will pay for some of the cost. So look, somebody's asked me about the out-of-pocket costs on top of Medicare. So yes, if you, Medicare will pay some for this operation, but it's only about $1,000. So it's not much, unfortunately. But if you have private cover, then the bed and the theatre fees are covered, and part of the anaesthetist and my fees are covered. So Medicare will only pay for about $1,000, but if you're privately insured, then the fund normally pays for about $5,000 or $6,000, depending upon your level of cover of the total cost of the operation. So in terms of Medicare item numbers and tummy tucks, so unfortunately 2.5 years ago, Medicare removed the item number for most tummy tucks, which involve muscle tightening. So one of the questions is, are you covered by Medicare if you need a tummy tuck because of muscle separation after pregnancy? So unfortunately this is being argued at the moment, and the Plastic Surgery Society has actually provided some evidence to Medicare to try and get the item number reinstated, and it's currently being assessed. But unfortunately at the moment in Australia there is no Medicare item number for people who simply have muscle separation after pregnancy, even though that there is good evidence that if you have a muscle tightening procedure, that again it improves your core strength, stress incontinence, back pain and a whole lot of other medical issues. So that at the moment there are only two reasons why you can get a Medicare item number for a tummy tuck. So one is if you actually have a hernia. So umbilical hernias are very common with pregnancy, so this is part of the same muscle separation that somebody was asking about. So with the abdominal wall, the muscles are stretched a little bit, and it's very common to have an umbilical hernia as part of that stretch. Now if you have an umbilical hernia that remains for a year after pregnancy, then there is a Medicare item number for that, in which case again, if you're insured, your private fund, providing that's got a adequate level of cover for plastic surgery, would pay for the bed and the theatre fee, and then part of the anaesthetist and the surgical fee. So the only other, so basically, I mean, again, in terms of the hernia, they're getting quite strict with Medicare now. You actually have to have an ultrasound before the surgery, which actually proves that you've got a hernia. And then you need to take intraoperative photos at the time of the surgery to prove that the hernia was repaired. So the only other circumstance in which there's a Medicare item number at the moment is after massive weight loss, which again is becoming a much larger proportion of patients who are having the full tummy tucks. So again, the very specific Medicare criteria, and for people who've lost a lot of weight, and there's a few criteria, but one is 5 BMI points, so body mass index points. So for most people, an average 70 kilo person, that means that you have to lose a significant amount of weight, and we're talking about 15 kilos or more. But I quite often see people now who have had gastric sleeves, gastric bands, who lose 30, 50 kilos, and certainly those people have a Medicare item number for an abdominoplasty. Again, a lot of people put on some weight during pregnancy, and if you are fortunate enough to lose that with exercise after pregnancy, then you may qualify for that item number. So not only have you got to have a 5 body mass index point weight reduction, but you have to have skin irritation that's been present for 3 months. So again, it's necessary to visit your GP, have ongoing treatment for that, and in that situation then there is a Medicare item number. So just in terms of the cost of the tummy tuck, so tummy tuck is the full tummy tuck where you tighten the muscle layer, is a much bigger operation. So most people have to stay in hospital 3 or 4 days after that. So one of the questions that somebody asked was, can you have a tummy tuck done as a day surgery procedure? So in terms of, hi everyone, there's some more people coming in, and hello to everyone. So we're now up to 20 people watching, that's great. So in terms of the question of can you do a tummy tuck as a day surgery procedure, you can do a mini tummy tuck as a day surgery procedure, but not a full tummy tuck as a day surgery procedure. So even in the United States, everyone stays in hospital overnight after a tummy tuck. Most people go home the following day in the States because of the much higher costs. The bed, just to give you some idea, the bed cost for most places in the States is about 3,000 Australian dollars a night, whereas the bed cost of a private hospital in Australia is about $1,000 a night. So because of that financial pressure, a lot of patients in the States, and you might read this online, go home the next day. But most people in Australia stay in hospital for 3 or 4 days. The earliest I've had somebody go home, I've had a few people who've gone home on the second day, but that really is as early as patients can go home. If you tighten the muscle layer, then it really is a sore operation. You know, for people who have had babies by caesarean section, most people feel that the recovery after a full tummy tuck with a muscle tightening is very much like a caesarean section. And so most people with that sort of procedure at 3 or 4 days can manage to go home, but they're still walking around very restricted. And most people after the full tummy tuck, it's 2 or 3 weeks to be back to reasonably normal activities, just starting to get around and drive, and really 6 weeks for full activities and exercise. So as I said before, just to make sure that you understand, the full tummy tuck is where you tighten the muscle layer, but the mini tummy tuck is where you're just cutting out the loose skin, but not doing the muscle tightening, and that's a much quicker recovery. So occasionally people go home the same day, or most overnight stay with that, and most people would be back to work by 10 days after a mini tummy tuck where you don't tighten the muscle layer. But nearly everyone after pregnancy, the muscle layer has stretched, and so you really do get a much better long-term cosmetic result. And you also get the benefits of increasing the abdominal wall strength in terms of pelvic tone, less back pain, those sorts of things. And so most people feel that it's definitely worthwhile having the full tummy tuck for those long-term medical benefits rather than just having the skin taken out. Just going on to some of the other questions that people have had from about tummy tucks. So one of them is saying, can a mons pubis reduction, so pubic reduction, be done at the same time as a tummy tuck? And does it cost extra, and is it considered a different procedure? So different surgeons will vary on this, but I consider a mons reduction actually part of a tummy tuck, especially after massive weight loss. A lot of people have some laxity in the pubic area that they don't like, and so all it means you need to do when you're designing the incision, you just take the incision 2 or 3 centimetres lower, so that you're actually doing a lift of the pubic area at the same time as the abdominoplasty. So it's for the same incision, it just means you go down a little bit lower. That's quite a common request these days. And certainly I consider that part of the abdominoplasty operation, the full tummy tuck, and I don't charge any more for that, although I know some surgeons do. So people are also asked about what is the ideal age in terms of your children's ages to have a tummy tuck. And so that's a very common question that patients ask. And really the answer to that is how much help you have afterwards. So it's very difficult picking up toddlers for weeks after this operation. And so definitely for the first 2 or 3 weeks after you go home, you need help at home if you've got toddlers. So once your children are 5 or 6, they can usually get up in the morning, get themselves breakfast, get themselves dressed. That means that things are a lot more manageable. And ideally, if your children are that age, then really it makes the operation much easier if you have minimal help at home. If your partner can take time off and be at home full time for the first couple of weeks, then that's not an issue. But again, people often have parental help in the first couple of weeks, But really that first couple of weeks you can't be lifting young children, you can't be out shopping and cooking and washing and lifting heavy washing baskets and those sorts of things. So really 2 weeks completely out of action when you go home. As I said, most people by about 2.5 weeks are back to driving, getting around. So at that stage you could take your children to school in terms of driving them to school. So again, this is a tummy tuck operation is very common for people to have this in the last week before the school holidays start, and so that you've got a couple of weeks not having to take the children to school and that sort of thing, and then by the time school starts, then you're right to go back. So I'm just looking at a question that somebody's asking. So if you've got back pain, so unfortunately, if you've got back pain at the moment, Medicare will still not cover it at the moment. So as I said, the Plastic Surgery Society has written to Medicare and has actually applied and given medical evidence to say that tummy tucks improve back pain and pelvic floor problems. And that's being currently assessed, and I would be hopeful within another year or so that the Medicare item number will be reinstated. But at the moment there are only two reasons why Medicare will fund it, and that is if you actually have a umbilical hernia as part of your muscle separation, or if you've lost a large amount of weight. So in terms of another question somebody was asking is really how long before I can go back to work. So if they've seen that they've got a job standing up, really if you've got a job standing up and doing a lot of physical activity, you really need a month to 6 weeks off after a full tummy tuck. So mini tummy tuck, you can be back to office work at 10 days and getting around, but you'll still be a bit restricted. Certainly within 3 to 4 weeks after a mini tummy tuck, you can be back to normal. But if you have a full tummy tuck and your work involves a lot of physical activity, standing all day, really you need to allow at least a month. So I say to my patients a month to 6 weeks, unfortunately. All right, so there's just another question about costing, so and the combination of operations. So the question is, do you do reduction in tummy tucks as one procedure or two, and is it cheaper either way? So again, this is a really common question with these sort of surgery. So nearly everyone who has combinations of surgery has them together, and that's for 2 reasons. One is that it is slightly cheaper having the operations together, and number 2, it's only 1 recovery rather than 2 recoveries in terms of time off work. So tummy tuck and a breast reduction together is a common combination, and I would do probably 1 a month where I do that combination of surgery. And it is a big operation that's making it a 5-hour procedure. So definitely with the combination, most people are in hospital for that 3 or 4 day mark. But again, nearly everyone has it because there's only 1 time off work, 1 recovery. And in terms of the cost, most hospitals offer a discount if you have 2 or 3 or more operations at one time. So Castle Craig Private Hospital, which is one of the hospitals I operate, basically if you have a second operation, they discount the theatre fees by 50% for the second operation, and if you have a 3rd or more operations, they discount the theatre fees to a 1/3 of what it would be if it's by itself. So if you have 2 or 3 operations together, then you save at least a couple of $1,000 having those operations together compared to having them separately. And that's, again, one of the main reasons that most people have these operations together. All right, so the next question is about drains and compression garments in terms of tummy tucks. So everyone, after a big operation like a tummy tuck, everyone produces some fluid as a reaction to the surgery, and so nearly everyone uses drains for tummy tucks. Now there are a few surgeons who don't use drains, but if you don't use drains, then there's a risk of fluid collecting in the tummy and then needing to come in every week and have that fluid drained away, sticking a needle through the skin. Now, most surgeons prefer to avoid having to do that and therefore leave the drains in, or put drains in at the time of the operation. And the length of time that the drains last is quite variable. So some people, the drains are out before they leave the hospital at 3 or 4 days. At some people, unfortunately, the drains can drain for 10 or 14 days, which is a real hassle. So part of helping the drainage decrease is wearing a compression garment after the surgery. And so at the surgery, we put you into a temporary binder, which is like a Velcro strap, which puts pressure on the area, and that does a couple of things. It minimises the amount of fluid that drains and gets those drains out early. But also most people who have the muscle tightening find it much more comfortable with the binder on. And so it allows people to get up and be more active with less pain. So another question is does the drain prolong recovery? No, the drain actually reduces the recovery afterwards, and having the drains in doesn't stop you being able to wear a compression garment afterwards. So most people, after the drains are out, and certainly by the time they're going back into normal everyday activities, stop wearing the temporary compression garment and get into some sort of other support garment like a girdle or Spanx, and wear that somewhere between the 2 to 3 week mark up to 6-8 weeks. Some people find that the support of the garment is really quite beneficial. It allows them to do more, and most people are comfortable wearing that for a month to 6 weeks after the surgery. So that's all the questions that I have. Anybody else? Would anybody else like to ask any other questions? If you put them on the screen now, I'll answer them. Otherwise, we'll start winding things up. So are there any other questions that anyone has? I'll be very happy to answer them. So look, in terms of getting more information, so if hopefully this is stimulated to give you some more information and do some more research. I find a lot of patients do a lot of research on this type of surgery now. Best thing is to just go onto my website, drcharlescope.com.au, and there's a lot of information on both of these operations there. If you have any questions, just shoot an email through. There are 2 or 3 ways that you can send an email directly through, and we will get back to you shortly. As soon as most of the emails are answered the same day as we get them. So look, if people don't have any other questions, sorry, there's some more questions coming in. Okay, so the pros and cons for opting for no belly button. So somebody's just asked about the belly button. So really, very few people don't have a belly button after this surgery. Really, you can, for most patients, unless you've had many operations around the belly button before, you can get a really cosmetically good looking belly button that's often better than the belly button before, and smaller, and most of the scar is hidden in the shadow in the new belly button. And so I would definitely recommend, the only people we don't put a new belly buttons in are people who have had multiple operations with a lot of scars around their belly buttons beforehand. And as I said, it gives a much better cosmetic result that way. So there's just another question. So is 10 days post extended tummy tuck and going back to work, just doing office work and very low impact, realistic? So 10 days is sufficient for a mini tummy tuck where you're not doing the muscle tightening, but if you're doing the muscle tightening, very few people go back to work doing office work at 10 days. So I have had the occasional patient who have actually been back to driving and office work at 10 days, but that is unusual. If you're having a mini tummy tuck, so that's skin only excision, that's perfectly possible. But if you're having a full muscle tightening tummy tuck, then you really need to allow 3 to 4 weeks to be back to doing office work. And a lot of people, even at 3 weeks, find that they're still restricted, they get very tired, and a lot of people at that stage are just doing half days or something like that. So if you're doing an office job where you can sit at a computer and do part of the work at home, it's perfectly possible to go back at 3 to 4 weeks. But if you're very active, then you really need to allow at least a month before you go back. So that's another couple of really good questions. Are there any other questions that people would like to ask at this stage, just while we're winding up? All right, well look, so if there are no further questions, as I said, if you have any other questions that you think of in a few minutes, just go to the website drcharlescope.com.au and shoot me an email and I will get back to you tomorrow. Thank you very much for attending this, and I'd like to thank Trish for the opportunity to do this live video, and hopefully you found the information worthwhile and interesting and has stimulated your thinking about the surgery. Thank you.